Good morning or good afternoon. My name is Casey Kelsey, and today I'll be doing my presentation on scoliosis. So to begin with the pathophysiology of scoliosis, scoliosis affects the body in many ways, both neurologically and muscularly. When this happens in the body, it's because there's a miscommunication between motor and sensory input signals that go from the brain to the muscles that control the spine. So not receiving these messages alters the body's position and the strength needed for movements. So pictured on the right are images of what scoliosis will look like in the body compared to a normal spine. So in cases of scoliosis, you'll see people normally having uneven shoulders or uneven shoulder blades that are more prominent, different hip heights, one that may seem to appear higher or lower than the other, or an asymmetric flank. So to understand scoliosis is the abnormal curvature of the lumbar or thoracic spine, or even both in most cases, because it can affect both areas of the spine at the same time. Scoliosis is defined by a curve greater than 25 degrees, and in cases where it's greater than 40 degrees, it is considered severe scoliosis. Now, just because your curve isn't greater than 25 degrees may not mean that you do not have scoliosis. You can still have functional scoliosis, or it could be a very mild case of scoliosis if it's under 25 degrees. Most commonly, it is diagnosed in children between the ages of 10 and 18. And in pediatric populations, females are 3 times more likely than males to be diagnosed. Scoliosis has a prevalence of more than 8% in adults over the age of 25, and it can rise up to 68% in the ages of those over 60 years old, which is normally what we call degenerative scoliosis. Also, more than 60% of cases will progressively worsen over time. So to continue, scoliosis can be idiopathic, meaning that it comes from an unknown cause. So most unknown causes can be due to genetics, and in most cases they're hereditary, so they could be passed down from one generation to the next without any cause or reason. Often, idiopathic scoliosis can be due to growth spurts during puberty. Now, during puberty, children experience rapid muscular growth and more growth hormone release, and due to this, it causes rapid spine progression that normally children's bodies can't keep up with, which is what's causing the curvature. Also, scoliosis can be due to posture and body alignment. So if anyone was born with a type of condition where they have poor posture or they develop poor posture, it can cause uneven shoulder height, which can cause the body to sink and cause the spine to curve. This can also be caused from uneven hip height, not just uneven shoulder height, or even leg length differences. So scoliosis can also be due to neuromuscular and congenital conditions. So neuromuscular causes are due to insufficiencies of stabilizers of the spine. So the things that keep the spine up aren't as strong as they should be. Now, some of these conditions could include things like cerebral palsy, spinal muscular atrophy, spinal bifidal, or any spinal cord injuries. Also, it can be caused by congenital conditions due to malformations of the vertebrae that develop until adolescence. Also, they can be due to changes in the central nervous system, and these include conditions that affect the brain and the spinal cord. Some of these conditions include things like intracranial hypertension, transverse myelitis, or hippocampal sclerosis, just to name a few. So when it comes to exercising with scoliosis, there are some key things you want to look out for. The first being, make sure that you're avoiding any activities that could cause spinal curvature progression. Now, this progression can be due to overuse exercises or using improper form during exercises. You also want to look out for injuring a muscle. This is a high risk when you're exercising with scoliosis due to the tightness and the pain that you'll be having in your back. Also, that's another thing to look out for is back pain. Now, one of the things I can't stress enough is when you're exercising, it is important to pay attention to your limits when you have scoliosis. If at any point activity becomes too unbearable, you should decrease your intensity or just stop exercising to avoid any further damage. Now, activities you want to be on the lookout for to make sure you're not doing when you have scoliosis is any activities that will cause strain on your spine or that will compress or flatten it over time. So these include things like competitive swimming, long distance running, because these things will compress and progress over time. Even things like heavy lifting or yoga where you have to do a lot of back bends or twists. Now, this isn't to say that if you have scoliosis, you shouldn't participate in exercises like yoga or heavy lifting, but it just means that they need to be modified for you. So when it comes to things like weightlifting, it's best that you try using assisted machines just to help alleviate some of that pressure and stress that you could be putting on your spine. So here we have a graph that demonstrates a sample of 765 patients with scoliosis, and they were treated with things from medication all the way to exercise. And this shows how the percentage of patients that improve, remain stable, or worsened. And a majority of them, 57%, improved from exercise and medication with scoliosis. So although 60% of cases with scoliosis will worsen over time, it can be prevented with the right treatments. So up next, we're going to get into the symptoms associated with scoliosis. So one of the first ones is more of a visual symptom, and it's the apparent curvature in the spine that you can see. This also comes with a difference in hip, shoulder, arm, and leg height. Another common symptom is muscle weakness. You normally will feel this weakness in different areas of your back and in your legs. This goes along with another symptom, the loss of coordination you have in your legs. Now, this loss of coordination is normally due to the pressure on the spinal cord, and it makes it difficult to walk. Another common symptom that is often felt is a numbness or tingling in the lower extremities, which is also due to that spinal cord pressure. Now, this sensation is normally felt in more degenerative cases of scoliosis, which are in the ages of 40 plus. It's less common in children who have scoliosis. Another common symptom is a reduced range of motion. That just is due to a lack of flexibility because you're very limited in a lot of your motions if you don't remain active and participate in flexibility exercises and yoga. Also, trouble breathing is a major issue. It's due to the pressure and tightness on your rib cage, and it can limit the space available to the lungs. Of course, pain is a symptom. You feel pain in most areas of your back, your shoulders, your neck, and your legs, and I know this from personal experience being diagnosed with scoliosis. Also, another factor of the pain are painful spasms. Now, these spasms normally occur somewhere around your back and shoulder area for me, and they can last anywhere from seconds to hours. Also, fatigue often comes with scoliosis. There are days when you just don't have the energy or the strength simply because of the pain you're feeling in your back. Even low self-esteem is a symptom of scoliosis that often goes unnoticed. Now, this next graph shows the different types of pain that people with musculoskeletal diseases felt, which includes scoliosis. And the most common side effects was just general pain and also lower back pain. But some other things to note were knee pain, neck pain, upper limb, and shoulder. This just goes to show that when you have a condition of this severity, you can feel pain pretty much anywhere throughout your body. It's not just limited to your back. So, medication use. So most medications are used for scoliosis to reduce pain and not actually fix scoliosis, because that's a different type of procedure. So common medications prescribed by doctors include naproxen and anti-inflammatory injections, and they are used to temporarily reduce pain. Also, ibuprofen is regularly prescribed to people with less severe cases to help reduce inflammation in the muscles and tissues that surround the spine. In more recent studies, actually, marijuana has been prescribed in cases where pain has become too unbearable and, of course, where it's legal. So, common treatments. All scoliosis treatments are subjective to the doctor and the patient, so there isn't a one treatment for all person. It really is dependent upon them, their pain levels, and what the doctor decides to do. So one treatment that is more severe is spinal fusion. So this is a cosmetic surgical procedure, and it is using curves that are over 45 degrees. So this would be more useful for those who have difficulty breathing and continual pain that can't be fixed with any medicine. So this procedure will stop spine progression and remove pressure from nerves and protect them from further damage. And on the bottom, you can see a before and after spinal fusion. So the spine was curved and now it is straight. Also, the most common treatment is scoliosis bracing. Now, this would be used for those who have curves between 25 and 40, so the more moderate range of scoliosis. And this will protect the spine from progressing any worse. And it should be worn daily. And it's more common in children, just because it's a little harder for adults to use it. And normally when you're in that phase, things like physical therapy would be more common, which we'll get into now. So physical therapy is a very popular treatment, and the goals of physical therapy are to calm pain and inflammation and also improve mobility and strength to help with daily activities. Now, physical therapy should be able to help you see improvements in posture, increased range of motion, strength, and also increased aerobic fitness. Most importantly, outside of physical therapy is exercise. Exercise is a great treatment in helping managing pain and increasing flexibility. Exercise programs should always include core strengthening and yoga. Not to mention, 87% of scoliosis patients use exercise as treatment. So for this case study, we have a somewhat physically active female who's in the 25-year-old range. She has a history of idiopathic scoliosis since childhood. She has a curvature in her lumbar thoracic region, about 22 degrees, has no previous injuries, but experiences pain when running and resistance training. She uses ibuprofen for pain management and has no other signs and symptoms of CVD. So her goals would be to be able to become more physically active, increase her strength and flexibility without any pain of her back. So according to the ACSM, those with lower back pain and scoliosis should follow closely with recommendations for the general population, which combine resistance, aerobic, and flexibility exercises. But these programs should be individualized to levels of distress, fear avoidance, self-efficacy, and controlling pain, and also coping strategies. So, for this person to begin with aerobic activity, we're going to follow the average recommendations by the ACSM, which would be moderate to vigorous intensity, 3 to 5 days a week for 30 to 60 minutes, and they can be formed in exercise bouts instead of straight through to avoid any pain. Also, resistance activity is a major key, and it should include core and back strengthening, and also 2 to 4 sets, 8 to 12 reps, which is normal. Now, where it's different is during flexibility. You want to incorporate more static stretching and active stretching at least 5 to 7 days a week, rather than the average 2 to 3 that the ACSM recommends for healthy individuals. Also, stretches should be held for 10 to 30 seconds at 2 to 4 reps. And with a program like this, you should be able to maintain your physical activity levels, increase strength, and avoid pain by incorporating more flexibility and targeting on the muscles that protect the spine. So here's the